Good afternoon, everybody. Good afternoon. I hope everybody enjoyed their lunch. If I see any of you nodding, I'm going to blame it on the lunch and not because I'm boring. But again, like Chairman said, I really focus my ARP on adoption competency among Mississippi mental health professionals. So I am the Adoption Program Director at Mississippi Families for Kids. Mississippi Families for Kids is a private agency in Mississippi that focuses on adoption, but of course we have a lot of other services as well. We're statewide, and like I said, we're nonprofit. One of the things that makes Mississippi Families for Kids so special, as it relates to what we've been talking about a lot during this fellowship, is looking at the disproportionalities and the disparities just among African American children that's in our foster care system. So Mississippi Families for Kids was actually founded by this wonderful lady right here, Dr. Linda West, who saw these disparities among African American children in our foster care system in Mississippi, and they just weren't being adopted at a rate that they should have, been adopted. So that's what makes Mississippi Families for Kids so special, because that's what it was built on. Another thing that makes Mississippi Families for Kids a really, really special agency, all of our programs, even though it started off with foster care and adoption, all of the programs that have grown out of that was grown out of the need of our families that were coming through our foster care and adoption program. So that includes our counseling program that we have, our kinship care program that we have, and some of our other outreach programs that we have, like different support groups. So I've been at Mississippi Families for Kids for about 10 years now. And throughout my journey at Mississippi Families for Kids, I've had an opportunity to work in a lot of different roles. And I'm so thankful for that, because I get to see adoption in different aspects. So I've served as the Adoption Program Director. I've been a We Just Want for Kids adoption recruiter. I've worked as a therapist at Mississippi Families for Kids, and a lot of other roles. But like I said, that gives me an opportunity to work with families in so many different ways. So probably about, almost 3 years ago, when I first was able to get my clinical license in social work, I wanted it to be very meaningful. And because I had such a passion for adoption, I wanted to find a way to tie adoption to my clinical experience. So in doing this, like I said, about 2 years ago, when I decided to do that, and after I had gotten my clinical license, I started to look for different training programs that focused on specialized training in adoption as it related to mental health. Well, I didn't have a whole lot of luck in doing that, but I came across the Center for Adoption, Adoption Support and Education, and I actually talked to someone about the training on adoption competency. Well, another challenge came up, because at the time there was no one in my state that was offering the training at the time. So I waited about 9 months, and about May of last year, there was an agency in our state that was offering the training, and I made it just in time to get enrolled in the training. So I was able to do the training for adoption competency through the Case Foundation, and I was so thankful for that. So that brings me to the issue that I see in Mississippi, which is we just do not have enough therapists in our state that are adoption competent or even know what adoption competency is. A lot of our children that are coming through care, a lot of the families that we're working with, it's just really hard for us to even be able to refer them to mental health providers that understand their adoption issues. So when I was going through our TAC training, we started off with, I didn't know that they had already had a class about 3 years ago, but in me going through the TAC training, I found out that there was probably about 4 other people who had gone through the training prior to our training class. So our training class, when I first started in the class, there were about 10 of us in the class. Sounds pretty good. By the time we finished the class, which it took us about 8 months or so, there was only 5 of us left. Another issue that I saw was that, and it may be a personal issue, but when we started, it was kind of split as far as like the race of the providers that were in the training and the experience that they had. So most of the African American trainers or therapists that were in the group and the ones that were actually working in adoption at the time, they were the ones that left the training midway. So by the end, I was the only one of color still left in the training and just really followed it all the way through. So that was really a challenge for me, because I know just in working with families and in working with mental health that our families, some of them, and our children have voice that they will prefer to work with, people that look like them. And because, I see, like I said, in working in different areas in the agency, a lot of our families that are not seeking out therapeutic services are, our families of color. So currently, there are about 9 people in the state of Mississippi that have gone through the TAC training. And I can say, I don't know if many of us, including myself, that are actually, working with a lot of families utilizing this training. Even though, like I said, some of us just finished up in April of this year. So in doing some of my research, some of the studies showed that, there are families would prefer to work with therapists that really understand their adoption issues. Many children that I've seen that receive therapy are children that are receiving therapy for behavior issues, not really adoption issues. So when I was a Wendy's One for Kids adoption recruiter, that was one of the things that I advocated a lot for our children. I would always ask, well, are they receiving therapy? Well, no. And I'm like, why not? Why aren't they receiving therapy? Well, they just haven't been having any behavior issues. They're doing well, in the home. But I've also seen the negative effects of that. Just recently, well, probably a couple of years ago, well, last year, I had a child who was not displaying any behavioral issues, but who ended up having an adoption disruption because he was never able to really express his adoption issues that he had. So he made the decision not to be adopted by a family that was adopting his brother as well. So just in talking with him and really understanding that, I realized, there's no one available to really work with this baby. He's not having any major behavior issues, but that doesn't mean that he does not, deserve to have some type of therapy, particularly from someone that is adoption confident. And then too, our adoptive families that do seek out services, therapeutic services for adoption support, there's just the resources are just very, very limited. even with me trying to refer families out. And I not only get referrals from families themselves, but other agencies like hospitals, that are looking for support services for families that they come into contact with, other adoption agencies, our state agency that looks at our private agencies for adoption resources. And it's just not a lot that we can give them. So experienced therapists who have an understanding of loss, attachment, trauma, and most importantly, adoption issues, like those are the therapists that are better suited to work with adoptive families. And I've heard therapists say, in working, a lot of our children receive services, therapy services from our community mental health centers. Of course, it's very fast paced, the children are really not getting the services that they're needing, and a lot of it is inpatient care. And I've heard therapists in those facilities tell me personally, I don't think that child's going to ever be adopted. They're just X, Y, Z, and because of their behavior, I don't think they'll ever be adopted. And in asking them, different questions about, well, what are some of the topics that you all are going over? What have you addressed with the child? And none of it is really, adoption related or related to the trauma that child has experienced. So that was very disturbing for me as well, which again kind of fed my desire to really look into this. Another barrier, in looking at this, it is a barrier to adoption, because if families are not being supported by professionals that understand their situation, it does lead to adoption disruptions or adoptions that being dissolved. So what kind of issue is this? Simple. It's a resource and a skill issue. It's as plain as that. There's not a lot of graduate programs or postgraduate programs that really focus on adoption competency. So we really have to try to get that involved more in our graduate programs. We're talking about adoption more, talking about foster care more in our adoption program. With our agency and me doing a lot of intern placements, I do have students that come to me and I do ask them about the courses that they take in their programs, and I take undergrad and graduate students, and they just really don't talk a lot about it. Now, we do have a couple of our universities that are offering courses in child welfare, so that's a plus, but still wanting to get that adoption plug in. So who does this affect? Like I was saying, it affects the families, it affects the children that are involved in adoption and involved in our child welfare system, but at the end of the day, it can also affect our child welfare agencies, because we're the ones that will have to address those disruptions and those dissolutions. So the goal for my improvement would really be able to increase the awareness of adoption competency. I don't think that we could ever get to a point where our state is adoption competent until we put it in the forefront and really have people to, one, know what it is, and two, really get a buy-in from it. And also just to increase the pre and post-adoption support for adoptive and guardianship families, particularly in the field of mental health. So our state does have one major agency that provides post-adopt services. And that agency, our state agency, has given this agency the funding to provide post-adopt services. Well, we all know that one agency can't do all the work for a state that adopt, for the whole state as it relates to adoption. But even making sure that that particular agency that's receiving the funding from our state, that they're providing quality resources for our families, and how do we get our other families that's involved with other agencies, because Mississippi does have a lot of private adoption agencies, but how do we make sure that all of our agencies are connecting and sharing resources. So looking at a little bit of the history from Adoption Competency, I was just talking to Yuri at the table about this bill from California, but they actually had the first legislation that focused on adoption competency and the need for adoption and permanent competent mental health providers. So they required that families that are needing pre and post adoption support services as it relates to mental health, that they are receiving it from mental health professionals that have actually been trained in adoption competency. They're required to have a minimum of 48 hours of adoption and permanency training from an evidence-informed curriculum. So what is adoption competency? So I know there's a lot of words on here, but adoption competency is basically a professional that has gone the extra mile to have that training in adoption-related issues, have a deep understanding of how those issues affect families and how they affect the children, really understand their loss and trauma and attachment issues. But like I said, just being able to go that extra mile, and someone who has that clinical experience to be able to provide that type of service. So to get to my PICO, if adoption competency training became a priority in our child welfare system and was offered to more mental health professionals across Mississippi, would more adoptive families have access to therapy that focus on adoption issues? So would they have more meaningful resources? So in looking at how we could actually implement this in Mississippi, thanks to Melinda and her, connecting me with some people, I talked to a young lady from Florida who was very instrumental in working with the state of Florida and bringing adoption competency to their state. One of the things that I was very impressed about is she gave me a website, which is here, adoptflorida.org. So after these therapists have completed this training, families can go on this website and they can see all of these therapists that are adoption competent. And they were across the state. So it wasn't like they were, really populated in South Florida and none, in other parts of Florida. But I thought that was so awesome. And I thought that it probably is needed in every state. But I was very impressed by that. And they used a training through Rutgers University, adoption competency certificate program. So this is just a list of some of the adoption competency training programs that I found. As you all can see, it is a very short list, but there may be some more out there, but this is what I found. But of course, CASE is one of the major ones, and it's one of the ones that I focused on for this action research project. So again, like I was telling you all before, I have gone through the TAC training myself, but I know that the TAC training can take a lot of time. It's expensive to go through the TAC training, which is one of the things that I found out why a lot of mental health professionals in our state weren't doing the TAC training. Was because of the cost of it, and the agency that provides that TAC training, they were telling me that they may have to go up on the cost of it. So, just to be able to offer it. but again, lack of resources. So that's when I came across the NTI project, and I'm glad that Kelly talked about that because it gave me even more confidence in the NTI project and how awesome it is and how it will really benefit our state. I'm also pleased to hear that not only have I been looking into NTI, but our adoption program director at our state agency has also been looking into NTI to really be able to implement it with our child welfare workers. So we can kind of get it on both ends. So the NTI project, we weren't one of the pilot states, but it will be available for us to be able to use it in September. So I'm excited about that. So I've been working really close with them on just trying to get some people to do the NTI training in Mississippi. So what my plan was is, like I said, just to get some buy-in from mental health professionals in our state, I decided to do a needs assessment just to see how many people even knew anything about adoption competency, and how that NTI, how did they perceive NTI, and would that be something that they would be willing to do? So I sent the emails I emailed the assessment out to several different mental health professionals, just randomly. I sent out about 60 emails, and then I also used a platform which a lot of us use a lot anyway, which is social media, but in a good way. So, in our state, we have a social work group, a professional group on Facebook that was actually started by, well, she was one of my interns at the time, but now she's a co-worker of mine, and someone else from one of our universities that I work with a lot. So this is a closed professional group, but it is full of social, it's probably about 5,000 probably now, because we've got some people involved that's out of Mississippi. But there are several social workers, and we do a lot of networking through that particular group. So I posted that survey on that group as well, and I think I probably got more participation from the survey doing it that way than sending out individual emails. So I had a total of 30 surveys completed in a very short amount of time. The participants included licensed social workers, LPCs, and certified mental health professionals. Another thing that I did too, and I learned this a lot from our agency, in order to get people to do something, you may have to give them something. So what I did was I offered a gift card for people to complete the survey, and I did a drawing for the gift card. So it worked. So another thing that I looked at and looking at the surveys was, where were these surveys coming from? Where were these therapists located? And that's important in our state, because if we have a lot of therapists in central Mississippi and very few in North Mississippi or South Mississippi or up in the Delta area, where some of those areas they already lack resources. So I wanted to make sure that we had enough participation in all parts of the state so that it won't be another barrier for families. So like I said, I was excited to see that we did have some participation on the survey from all parts of the state. Just looking at the type of agencies that the therapists who responded to the survey came from, we had some that worked for private child welfare providers that were contracted by the state. That was about 10%. The most The biggest part of it were 25%, which was the community-based mental health providers. And like I said, that was really good because a lot of our children go through community mental health centers. The other, I think some people just kind of just didn't want to put themselves in one of the other categories, so that was kind of thrown off a little bit. But a lot of these providers worked in private practice, which was a population that I really wanted to reach out to anyway, because they don't have to really deal with, okay, this is what my agency wants me to do, so I'm going to do this. My agency won't provide me with enough time to do this, so, just looking into that. Also, looking at how many of these therapy providers actually work with adoptive families, and the majority of them did work with adoptive families, 67%. Need for adoption company mental health professionals. Most of them felt like, we do have a high need for mental health, adoption company mental health professionals. Looking at to what extent did they consider themselves to be adoption competent? Well, only about 23% said that they felt that they were adoption competent. Okay, how many were formally trained in adoption competency? So 37% said that they felt like they were formally trained in adoption competency, but out of those 30 surveys, when I looked at the type of trainings they had done, really only 2 people out of the 30 had gone through a very formal training. Some say, well, I was trained by my agency, but it's more so like, the training everybody gets when they come to work for the agency. How much professional development have you had on the topic of adoption? So a few have had some professional development on the topic of adoption. We have a conference every year it's a child welfare conference, and normally at that conference somebody presents on adoption. We may have a couple of sessions on adoption, so I can see, some people getting some of that professional development on that because it's more than just child welfare workers that come to that conference. How important is adoption and competent therapy to your practice? I guess about half thought that it was, somewhat important. And the thing about it is, and y'all, I'm kind of rushing through these slides because they've already given my 5-minute warning. But you all can kind of look at some of the statistics or whatever. So just looking at, just how feasible would it be for these mental health professionals to do an online training such as NTI, and that was my ultimate goal is to try to get some buy-in, for them to participate in the NTI training. So looking at some of the benefits and the challenges of it, well, a lot of people said they felt like, it was very flexible for them to do online training, just having that convenience of doing it. It's cost effective, especially with NTI being a free training, so more people were willing to do it. But some of the challenges was just that inability to have that one-on-one interaction, being able to ask questions the way that they needed to, and making sure that it will be approved through the licensing boards. And as social workers, trying to get those CEUs to renew licenses is very important. So out of those 30 surveys, 77% said that they were interested in the NTI training. So what are my next steps? Really being able to connect with those providers who were interested in the training and just following up with them to make sure that they get the information that they need on the NTI training, because I don't want to just start this and then just drop the ball on this. Being able to share their contacts with NTI as well. so that they can, see that, hey, it would be a good idea to really get the ball rolling in Mississippi with that, and we've already kind of started doing that. And just being able to continue to spread the word about adoption competency. So, how has MPLD impacted me? Well, I can say that it has really heightened my leadership skills that I didn't even know I had, I think they just have really been brought out. It's allowed me to be really more verbal on a bigger platform, because Ms. West will tell you, like, I'm very verbal in the office and expressing my frustrations about things that not only go on in our agency, but also in our states. But throughout this project, like, I've seen myself really talking about this research, to our state agency people. I don't talk to them at the county level. Like, I try to make connections and form relationships with our state agency, because I know at the end of the day, those where the decisions are made. So that's given me more confidence in being able to do that. And just being able to network with other people in child welfare. So the impact of my research, I just want families to have the resources that they need, so that their placements can be sustainable, that families will be long-lasting, and when families call us needing assistance or needing help or needing resources, I want to be able to give them those resources. And any other agency that they call, I want to be able to share information so that any agency can give them what they need.